All right. Now, this is the level of evidence or grading evidence according to its strength in the Center of Evidence-Based Medicine. Now, this is a pyramid which indicates the evidence hierarchy. The top is the most valid and the most appreciable. It is the most valid. The first would be the systematic reviews, right? And meta-analysis of multiple research tests. These are integrated research of primary researchers. These are the most valid researchers. This is followed by prospective randomized blinded controlled trials, or RCT, followed by cohort studies, case-controlled studies, and the least is expert reports and case reports and expert opinions. What is a systematic review and meta-analysis? These are what we call integrated studies. They are powerful ways to assemble multiple studies and synthesize their findings, but these studies should be homogeneous, carefully selected homogeneously, and I will discuss this later on. Then this systematic review and meta-analysis or integrated studies, as compared to narrative studies, it is based on objective evidence, transparent, and minimizes bias. What is a systematic review? It is the foundation or the gold standard for the evidence-based approach. Is the systematic literature review, which differs significantly from the narrative review. Systematic reviews use explicit standards for evidence retrieval. The way they get the researchers they put together or assimilate, they should be homogeneous. And also the assessment and synthesis, how we synthesize the various results and put them into one. They undertake from primary research, with each study treated as a unit of analysis using eligibility, critical criteria for its inclusion. Also, have thoroughly documented and reproducible methodology. So the systematic reviews use explicit standards for evidence retrieval, assessment, and synthesis, undertake from the primary research, with each study treated as a unit of analysis using eligibility, criteria for its inclusion, and have a thoroughly documented and reproducible method. A narrative review, in contrast, which is a traditional review article, is broad scope, not selective, informal, and subjective, supporting the author's review. It is subjective and supports the author's review. When written by different authorities, may arrive at different conclusions. The selection of studies is subject to bias and overall inaccurate conclusions. Now, this just shows you that some people in research, what they do, they always want, sometimes they want to prove that the new methodology is true. So they take the results and try to fit them in a certain way such that they prove their goal. So this is not honest, and it is called data torturing, exploring the data with the goal of providing a particular point of view. What is a systematic review again? An overview and meta-analysis. An overview is critical appraisal of multiple studies and using unbiased scientific methods for their integration. Qualitative systematic review. A meta-analysis, when the results of two or more, very important now, homogeneous. The studies should be homogeneous, and the way to do homogeneity is very, very critical. And then these studies will be combined statistically. So this is what we call a quantitative systematic review. When results of two or more homogeneous studies combined statistically, The review is called a quantitative systematic review or meta-analysis, thereby obtaining a single estimate of effect, leading to greater precision of the estimate, and we also have an increased statistical power. The strengths of integrated studies include: 1, we have a clearly defined question, a PICO question, as I showed you before. Then we should have a comprehensive search strategy using keywords for retrieval of selected primary research. We should have also explicit inclusion and inclusion criteria of all articles selected. We should have, of all articles selected, similar duration of observation period, nothing less than 12 months duration of observation period, not 3 months or 6 months, nothing less than 12 months observation period. Also, the withdrawal of patients should not be more than 20%. 80% of patients that are left or that are studied are acceptable, but 20% or more withdrawals is unacceptable. Also, assessment of methodological quality of the included studies. And at the end, we do the synthesis of data, and at the very end, a summary of the results and conclusions.